So now the palpation of lateral ankle. Again is a start with the first with localization. So for localization we have to identify the one of the most common bony landmark, that is your lateral malleolus. So as compared to the medial malleolus, it is more prominent. So we can identify it very easily even without palpation. You can identify it, the location of lateral malleolus, on the basis of observation. Even though for identification of the margin, we have to precisely identify the all the margin of the lateral malleolus. So I just already marked. So this is the location of the anterior, posterior and inferior margin of the lateral malleolus. Again, like the medial malleolus, all the aspect of the lateral malleolus is used for a reference. So let us start. First, identify the lateral malleolus, perform this grip. Even in pathological condition, this may be covered with the swelling, or in some condition it may be covered with adipose tissue or soft tissue. So in that case you have to identify it with palpation, and for palpation you have to use the same grip whatever we use for identification of bony prominence. First, place your hand like this, perform circular palpatory technique, identify the bony prominence and then mark the margin of the lateral malleolus. It is marked anterior margin, inferior and posterior margin. So let us start with the inferior margin. You have to slide your thumb pad inferiorly and perform the circular palpatory technique, and you will identify a small bony eminence over here, that is called the peroneal trochlea. Basically this peroneal trochlea separate here the two tendons of the peronei. One is your peroneus brevis and second is your peroneus longus. We can also identify the peroneus longus and brevis just proximal to the posterior margin of the lateral malleolus, but here we cannot differentiate which of the tendon is of peroneus longus and which of the tendon is your peroneus brevis. But here basically this small bony landmark basically used for differentiation between the peroneus longus and brevis. The tendon which is passes just above the peroneus trochlea is basically the tendon of your peroneus brevis, and another tendon which passes under the peroneal trochlea is your peroneus longus. How to identify? Just make a grip like this, ask the subject to evert the foot and again perform your transverse palpatory technique and identify the tendinous structure or which is getting firm when the subject try to evert the foot. So here I can feel the tendon. If suppose I am just performing it over here, so here I can also identify the tendon, but here is the overlapping. After the peroneal trochlea there is separation of tendon and we can identify two different tendons over here. Ask the subject to perform this movement again and again and confirm your location. If you are following this tendon, ultimately you will reach over a bony prominence which is found over the lateral side of the heel, or you can say lateral side of the foot. So, it is again, it is marked over here. Basically, it is your location of your base of the fifth metatarsal. Okay. Now come to the next structure, or we can also identify this uh, tuberosity or base of the fifth metatarsal directly. For that purpose, you have to place your thumb pad over the lateral side of the heel, apply firm pressure, slide it in the direction of the little finger, and ultimately you will strike over a bony prominence, which is your base of the fifth metatarsal. So, we have two methods depending which type of pathology or what are you trying to identify, your palpation will depend on that. The next structure is to identification of calcaneocuboid joint. So, basically this black line is representing the location of your calcaneocuboid joint. Same the procedure, whatever the procedure used for identification of the base of the fifth metatarsal, the same procedure we can perform. Place your thumb pad over the lateral side of the heel, slide it towards the fifth toe, and same time passively you have to bring the foot in adduction and try to identify the gap between your calcaneocuboid. So, here by applying this pressure, we can appreciate the gap or we can appreciate the movement between calcaneocuboid joint. So, just slide it in or just follow it in upward direction and you can identify the calcaneocuboid joint. The next structure which we can identify over the lateral side of the ankle, and that is very important for clinical purpose, is basically these two locations which is related to your ligament. One is your location of your anterior talofibular ligament. This is the location of your posterior talofibular ligament, and this is the location of your calcaneofibular ligament. So, basically this area remain filled with the tendon or multiple soft tissue. So, it is little bit difficult to identify the posterior talofibular ligament. But here if you identify the anterior margin of the fibula, this is the location and most commonly injured ligament in case of lateral ankle sprain. When you apply the pressure just anterior to the anterior margin of the fibula over here and perform this movement, you can find the elastic consistency over here. For confirmation or for grading, you can apply a eversion movement of the foot and this will lead to the tensile stress in your anterior talofibular ligament and you can identify it very easily. The same procedure we can identify, first identify the most inferior margin of the fibula. Place your thumb pad like this or finger pad like this, apply a varus stress and perform this transverse palpatory technique, apply firm pressure and identify the elastic band like structure which is your calcaneofibular ligament. So, it is all about the palpation of your lateral ankle